I offer basically a full range of facial cosmetic and reconstructive procedures. These range anywhere from simple injectables such as Botox, facial fillers, fat transfers, up to more invasive surgical procedures including eyelid surgery, both upper and lower eyelids, in addition to nasal procedures such as rhinoplasty, facelifts and neck lifts, in addition to other general aging changes or other skin changes associated with aging. There are other reconstructive procedures I often perform, such as closing skin cancer defects, even removing the skin cancers themselves. As far as a typical patient, actually there probably is no set mold for any type of individual patient. Everyone is very different as an individual. Most patients come in and what might bother one individual is something completely different than what bothers someone else. I think that's the real trick to facial plastics, the real art of plastic surgery, is trying to listen to your patients and trying to glean from them what they're really looking for. Just because something can be done doesn't mean that surgically it should be done. It really is trying to basically offer what I can do both physically and with the help of, again, fillers and implants, and trying to meld that with what the patient's actual desires are. When it comes to reconstructive procedures such as skin cancers, those are typically more mandated by what the skin cancer leaves. As far as when that skin cancer is removed, there's a certain size defect that's left in the skin, and that really dictates how those are able to be closed and in what manner that can be done. I think that the most common procedures that most patients come in to discuss include facial fillers and Botox injections. After that, I do a fair number of facial chemical peels, both medium strength peels and also deep peels, both of which give different outcomes depending on which peel is chosen. Other procedures include lip implants and also facial augmentation, such as with fat transfers. Those are probably more common as far as the less invasive procedures. When we start talking about the more invasive procedures that require surgical intervention, those typically are going to be blepharoplasties, which is also known as upper and lower eyelid surgery, in addition to face and neck lifting, and also nasal surgery such as rhinoplasty. I think that some of the most common questions that I have from patients when they first come in, especially on initial consultation, is basically what can be done to make me look younger? And that's probably the key question I hear from almost everyone. Not every patient comes in knowing exactly what they want to discuss. They feel like they look tired, they feel like they look a bit older than they wish to, and they want to know what options they have to help to make them look a little younger, make them look a little bit less tired. Some patients certainly do come in with a specific question. They have a certain area on their skin, they have a certain mole, they have a certain lesion someplace they'd like to discuss being removed. They come in with a certain problem they note in their nose, or they have a problem on their eyelids, or they feel like the eyelids are sagging. They also might come in discussing the problems with the volume in their face, and they have more wrinkles and more lines they would wish to have. Sometimes they come in discussing or wanting to discuss problems with some spots on their skin, such as those that we get from sun exposure. And those are probably the more common questions that I hear. So not everyone has a specific defined question. Sometimes they just decide to come in and talk and see what options they even have available to them. So having that in mind, that certainly allows me and also the patient certain flexibilities where we can really discuss any options that they might wish to discuss. This can again range from procedures that are commonly performed to more uncommon procedures. It really depends on what needs to be done for that individual patient. So everybody is an individual, and everybody really has their own prerogatives as far as what bothers them the most. And there's really no limit to what can be discussed. It's just, in my mind, I think it's a discussion between the two of us to try to determine what is going to give you the best benefit, and not allowing patients to overdo certain procedures or do things that they might actually get more harm from doing than actually getting good out of it.